everybody, welcome back to my channel. It's at Mary Z. Thanks so much those who have already subscribed to my channel. I'm really happy and grateful. So after watching this video, those who have not subscribed yet, please do subscribe, share and like the video. I have a very great interest in the cardiovascular system, and over the years I got exposed in nursing care, and also have great interest in reading about the human anatomy. So today I'm going to just give a few highlights on another problem, a cardiovascular problem known as the congestive heart failure. There are two problems which might occur: the congestive heart failure and a heart attack. Those two problems are different. Congestive heart failure is when the blood fails to pump blood to the cells of the body, and sometimes a little bit of blood enters the cells, and then it becomes a problem. And sometimes the blood just accumulates on some parts of the body, like the feet, the legs and the stomach. But when we look at heart attack, it's when the heart itself has a problem. So it means blood and oxygen cannot be pumped to a particular part of the heart. That's when a heart attack occurs. So I'll be looking at heart attack in the next video, but today I just want to concentrate on the congestive heart failure. So how does this happen? Congestive heart failure is a long-term condition. It occurs over time. As years go by, this problem starts and continues to go on over a long period of time. What happens is the heart, like I've said, is not pumping enough blood to the cells, and the result is that this blood might build up in some parts of the body, like lungs, legs and feet, or even stomach. So we need to know what causes congestive heart failure. Congestive heart failure is caused by some of the other cardiovascular problems or diseases. It is caused by coronary artery disease. Coronary artery disease is when arteries are clogged with some substances and forming plaques in there, not allowing blood to flow freely. So that is congestive artery disease, can lead to heart failure. The other one is arrhythmia, when the rhythm or how the heart pumps, the speed of the heart is not regular. This also can be a problem leading to this disease called congestive heart failure. High blood pressure also causes congestive heart failure. High blood pressure normally should be around 120/80, but when it goes very high or very low, we end up having this problem. It will lead eventually to heart failure. And the other one is cardiomyopathy. It's just the heart is not pumping properly. And also diabetes can also, diabetes, our organs work hand in hand. Our organs in the body don't work solitary. So the pancreas is another organ which produces insulin. So some complications with with insulin production can lead to diabetes, and this eventually also has some part to play with the problems of the heart failure. So we really need to be aware of what happens in our bodies. So we might ask ourselves, when we have, or when we happen to have this problem of heart failure, we need to know the signs or the symptoms. We need to be suspicious when we have problems like chest pain. It might be, it might be a sign that our heart is failing. So chest pain is a sign of heart failure. But also you need to note that the diseases of the heart are linked. They are always linked. They can come from one disease to another. It's like a chain, So we need to be mindful when we experience chest pain. So it's we put the responsibility to our doctors and physicians to investigate and tell us what really is happening. So if it's heart failure, then they will inform us and appropriate intervention can be taken. Sometimes we have palpitations, heart palpitations, like the heart is just pumping irregularly. So this might be a sign that we are having heart failure. So again, when we experience such a symptom, it is really essential to seek medical help. And sometimes we feel fatigue. We cannot do anything like tasks. Even we can't walk, we can't do normal day-to-day tasks. All we feel is fatigue. Fatigue means tiredness. So if you feel that all the time you're trying to do a task, you can't even maybe walk, you can't do like the normal duties like bathing yourself, and you can't cook for yourself, you just feel tired, all you need to do is to sit. That's what we mean by fatigue. Your body is just weak. All you want is maybe just to lie down or sit. So if you feel that, you need to be suspicious of heart failure. So always consult the physician, always consult the doctor, because these cardiovascular problems, like I said, they go from one thing to another, and then you keep on deteriorating. So it's wise to seek medical help. So fatigue is another symptom to take note of. And sometimes you discover that there's a swelling on your ankles, your feet, even your abdomen is swelling up. So when you discover that your ankles are swelling up, it's very advisable to seek medical help, because we don't want to this condition to deteriorate. And heart failure, like I said, it is not a condition which we must just watch. We need to seek medical help. So these are the symptoms, some of the symptoms of heart failure: chest pain, arrhythmias, fatigue, swelling ankles, swelling legs and abdomen. So we should be mindful of that. So to sum up this presentation, remember, heart failure or congestive heart failure is different from heart attack. And heart failure is when the heart is not pumping enough blood to the cells. And sometimes this might result in blood building up, and you notice your legs swelling, your feet swelling. So this is what happens when we are we are having the problem of heart failure. And remember also, it's a long-term problem. So it's advisable to seek medical help anytime you feel the symptoms, like the symptoms I've said: shortness of breath, chest pain, heart palpitations, swelling of body parts. So I hope you have enjoyed this presentation. I'm really I'm really looking forward to more subscribers, and when you watch, please do like, share the video, and comment. Thank you so much for watching. I'll be bringing more and more fascinating, educative, informative videos.